Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I am a certified hand therapist, and today's video is going to be part 3 of our 7-part series focused on management of wrist tendinitis. This video series again is targeted towards therapists, OTs, PTs, hand therapists, but certainly if you are somebody that struggles with wrist tendinitis, it is also okay for you to view some of this information as well. In the last 2 parts, we talked kind of some general principles of treating tendinitis and kind of introducing the assessment portion of treating wrist tendinitis. So if you missed those first 2 parts of this 7-part series, go ahead and check those out first. I'm going to post the link in the description below. But let's get into part 3 today. That is going to be talking about activity modification. So let's get into it. Okay, so activity modification. So in my opinion, as a clinician and as a therapist and just as a human in general who has gone through some repetitive strain types of injuries before, I truly believe that activity modification is the most important or crucial part of your treatment plan. It's the most important thing that you can educate your patients that are struggling with these types of injuries in. I like to tell my patients this simple metaphor because it helps them to understand why I'm telling them this activity modification and not just giving them exercises, which is usually what patients really want to fix the problem. So I like to tell people it's like having a rock in your shoe, right? This kind of injury is having a rock in your shoe. You can stretch your foot and it might give you some temporary relief or relieve some of that pressure, but if that rock is still in the shoe, it's not going to fix the problem, right? So we need to figure out, you did some sort of activity, some sort of repetitive stress, awkward posture, maybe there's some mechanical dyskinesis or something like that, or awkward postures that have caused this to happen. We need to take care of that part of the system and avoid some repetitive stressful activities, modify our activities to avoid aggravating the tissue to let it get better. So I find that metaphor has been pretty effective for explaining to patients why, just exercising is probably not going to be enough to fix this issue, because you want to avoid stressing the tissues, right? And your body will tell you what's bothering it. Everyone comes in wanting stretches or exercises or strengthening to fix them, right? They want us to just, here you go, here's some exercises you can do. It will absolutely make this better. The most important thing is modifying those activities to avoid overloading or overstressing those injured tissues, which will not only help you get better from the pain you're feeling, but if you continue to be consistent with doing those activities differently, it can prevent future injuries as well. Now, the types of modifications that you recommend or suggest are going to vary person to person. They're going to vary on the person's occupations, hobbies, activities, but it's also going to vary on which tissue is being overstressed, right? I always think about, we have lots of types of people in our clinics, right? If you're treating somebody who's a professional musician, you're not going to be able to tell them you can't play your instrument for the next 6 weeks, right? That's not going to happen. Same thing with somebody who's an office athlete, right? They can't just take 6 weeks off of work most of the time. And even if you do take that time down, remembering that tendinitis typically takes a long time to heal. They might feel better in that initial, few weeks of rest, but as soon as they go back to that aggravating activity or the repetitive activity, the symptoms are just going to come back up. So I usually educate the patient, think about it this way. What things do you have control over? What are your priorities that you need to do or you want to do in a specific way? What things are not high on that priority list? What things can you control in your life to minimize stress? So sometimes I'll give the example of, you might want to, if we're thinking about our musician again, right? You might want to be able to continue to play so that you can perform for your gig coming up. So you need to have, 3 hours of practice a day, and maybe you can't modify that. But do you really need to open that can of pickles jar, that jar of pickles by hand, right? Or can you use a tool? Can you have somebody help you, right? Can you get one of those little tools that allows you to do that in a more ergonomic, controlled way with less stress on the tissue? So I like to give that as an example. I also like to use the example of chopping vegetables in the kitchen. And so if you are somebody that does a lot of cooking, is it a really big priority for you to chop all of the vegetables? Or could some of those be bought as chopped packages, right? Like there's options out there. Or maybe you get an electric chopper or something like that, so that the amount of stress on your hands is a little bit less. So those are some of the examples that I like to give people. I also tend to do a lot of education on body mechanics, keeping the load close to your body, lifting things from underneath versus picking things up one-handed. Always using two hands is going to be better to split the load. Using the larger joints and muscles, right? If you're carrying groceries, you don't really want to carry them in your hands. You can always loop the bag on your elbow or shoulder because those larger joints are meant to take more of the stress. And also I like to encourage people, keep your wrists neutral or straight, right? You don't really want to be picking up the pot or pan like this, because what does it do? It just puts all of that load onto your wrist or your tissue, right? So instead, maybe you can get an oven mitt and you can scoop under the pot and under the handle and lift with a very straight wrist. So I do a lot of education on look at your posture, look at your positioning, prioritize your activities, and find some things that you can minimize the amount of stress on those tissues throughout the day. As therapists, we can also suggest adaptive techniques or tools, setting up the environment in a different way that helps to improve their ergonomics and reduce the stress of a task that they might need to do. We can, help them kind of problem solve through their activities and figuring out different ways of doing them. One big example that I'll give is for people that are athletes or musicians or the weekend warriors who are working out, or even office athletes, right? The people that are on their computer all the time during the day or they're stagnant at a desk. Try to warm up before you get into those activities, right? For a musician or an athlete or somebody who's working out or going to be at a desk chair all day, do some warm-ups, not just with your activity specific, but doing things like jumping jack arms or marching in place. Get your body warmed up a little bit, do some movement of the parts of the body that are going to be doing the work. I also tell people, take breaks frequently throughout the day. You are not meant to do one activity for hours at a time ideally, right? And again, I stress this with a patient, like this is ideal. Every 30 to 45 minutes of activity, you really should be giving yourself kind of a micro break. For musicians, I typically tell them if you play an hour, 15 minutes of that should be rest time or break time where you're not holding the instrument or you're not in that position. It's hard, you're going to be able to tell them what the ideal is and tell them also, I understand that this may not be feasible for you, but if you can shift to help with some of that, right? Like if you can take on some more breaks, that would be helpful. Or if you can do a warm up before you practice or a warm up before you sit down at your desk, those things can be really helpful. You have to work with them, right? To find the right amount of activity and rest that is realistic for them and that they're going to be able to adhere to for the period of time where they're trying to heal. So I truly believe that activity modification is one of the most powerful tools that we as therapists can give our patients, because again, we're not treating them for 12 to 16 months typically, nor should you, right? We are giving them the tools that they need to be able to work through their pain, to fix or heal their tissues and to prevent future injuries. So we need to empower our patients. Like, you need to take this on as part of your responsibility so that you can help yourself get better, but also to prevent future injuries from happening. Because I'm not going to be with you when you're at home in the kitchen. I'm not going to be with you when you're at the gym. I'm not with you while you're performing. I'm not with you at your work, right? So these are things that you need to be able to do for yourself. So I truly emphasize activity modification. I know it's hard. A lot of patients really don't want to hear that stuff, but I think if you can get them to buy into it, even in small amounts, it is going to make their symptoms so much better over time. So I would highly recommend making that a big part of your treatment plan for any type of repetitive strain injuries, but certainly wrist tendinitis would be included in that. Okay, so that pretty much wraps up this third part of our wrist tendinitis management series on activity modification. Just a general overview for you guys, stuff that I tend to focus on or think about. And I hope this video was helpful for you. If you have other ideas, things that you typically share with your patients about activity modification, or helping them to be compliant or consistent with that at home, post them in the comments below. Thank you guys so much for watching, and if you have not subscribed to the channel, please go ahead and do so. Your support is so appreciated. And if you liked this video, give it a thumbs up, and I will see you guys in the next one. Thank you for watching.